So we've talked about the presentation of how this typically looks like. So now we're going to get into like why this happens. The biggest reason why this happens is because we have, if you look at this as like our disc, most of the time with our neck, what are we doing? We're looking down. We're looking down using our phone. We might be slouching. So if I go and I slouch, my head will come with that. And so our joints don't like being in that position. It's very similar to me pulling my finger back. If I hold my finger back like this, the joint doesn't like being in there. But if I'm there for 8 hours a day, day after day, I have to come out of that position for it to recover. And if it doesn't, you go back into that position, you'll start having issues. So if we're always bending forward and we have our nerves that come off to the side, the disc will push against the nerve, and that's what's going to send pain down the arm. Now, we can ask questions. When you get pain down in the hand, and we ask questions like, where do you feel it? Oh, I feel it in my thumb. That's C6. When you feel it in the middle fingers, that's C7. And then when you feel it in your pinky, that's C8, T1. That's like at the cervical and the thoracic junction where they come together. So we even know which level it is based on where you feel pain in the arm. Now, we will test also strength to see if there's any, anytime there's, in the neck, you can have muscles that get inhibited. The common muscles that get inhibited are wrist extensors and then external rotators. Those are really common, but you also can get weakness in certain patterns. And you can have weakness because different levels of the muscle or different levels of the nerve compression will make certain muscles weaker and certain muscles stronger. So we'll take baselines of that. We'll also take baselines of dural tension to see if the nerve is not able to kind of glide. Really common when you have a herniated disc. And so, but we can use all these as baselines. Now, when we have baselines of neck range of motion, we have baselines of strength, we have baselines of dural tension, that's that nerve tension, putting the nerve on a stretch. When we have baselines, it hurts when I go down, maybe I can't go up as far, I can't turn as far, I have pain into my shoulder. These are all baselines for us. So how do we solve this problem? So the first step is we want to like reverse the direction, because think of it like a jelly donut. If we're always bending forward and it's pushing everything to the back, we want to go and do the opposite way to move the gel the opposite direction. The problem is in the neck it's a little bit trickier than that, because if you have something that's a little bit lower, which is really common, the most common area that people have problems with is C5, C6, and C6, C7. Why is that? As soon as we slouch forward like this, it hits right through here. That's where it likes to bend, and that's where we all have the most common problems with people. So if I go in and it's here and I bend here, I'm not going to get lower into the spine. And so you're not going to hit those levels down here by just bending backwards, by just trying to push in the opposite direction to move the material away. We've got to do something a little bit different when it's lower. So the first thing that you're going to do is you'll just start doing some neck retractions. Now, when you have something like a nerve that is giving you problems, sometimes doing neck retractions in a seated position, in a standing position does not work. It's too much. So if you do this and you're like, whoa, that's just too much, you're probably going to have to do it in an unloaded position, meaning lying on your back. So we can start out with things where you're just doing neck retractions like this, going straight down in an unloaded position. Now, sometimes you can get a towel to put around your neck, and you can do it off the edge of a table, or you can do it into one hand like this. So if this is the hand that you have symptoms with, don't use that side, use the other side. And you can do some neck retractions into the hand. Now, what does that do? That starts doing a little bit of extension through here. But when you have something like a nerve, you're going to want to start very slow, because if you go too fast, you can really irritate the nerve. When you have a herniation that's hitting the nerve, if you go too fast, you may pinch into that herniation and it can push farther into the nerve. So you want to start out slow, doing some neck retractions. And what you can do is you can, again, go back to those range of motions to just see, is my range Getting better. Does it feel easier to look up? Am I having less pain when I look down? Those are all baselines that you can use. You can use the baselines of wrist extension. Is it super weak? Is that getting stronger? Shoulder external rotation. Is that weak? Is it getting stronger? Those are all baselines to go, yes, I'm moving in the right direction because this is getting better, this is getting better. You might not fully get better, but if you're starting to get better, you know that you're moving in the right direction. So that's the first thing that we do, is start working on doing neck retractions. Again, more than likely, you're going to have to do it unloaded versus loaded, where your feet are on the ground, the gravity's hitting us this way. Unloaded is when the gravity is going, we're going kind of with gravity, which is lying on your back. So that's the first exercise that you should do. If that's feeling pretty good and you're noticing that your symptoms in your arm are actually getting better and they're starting to move out of your arm, and now you no longer have it in your hand, but you have it in here. That's what we call centralization. So when it centralizes to the neck, that's a really good sign. If you notice that you're having pain here and it's peripheralizing, it's moving down the arm, that's not a good sign. You need to stop what you're doing and like go get some help, because if you can get to someone that understands the body, they're going to be able to help you much quicker in understanding what to do. So centralization is good, peripheralization is bad. So when you're doing some of this stuff, pay attention to your arm. What does it feel like? Is there something is it making the arm feel better? Is it pulling the pain out of the arm? Those are all good signs that we're moving in the right direction. Now, one thing I'd like to say is sometimes when you get centralization and it moves into the neck, you can get even more pain in the neck. Even though the arm feels better. I'm okay with that. That's very common. You're actually pulling it to the source of where the problem is, and that's where we feel it now, is where the problem actually is and not in the arm. So if you notice that, that is okay. So a progression that you can do is, if you can start from here and we can get up here to work on neck retraction, and this is fine, and you aren't noticing the symptoms peripheralizing, the symptoms are actually getting better, and you can stand up and do it, then great. Go in, start working on doing neck retraction, standing up. The next phase of this is to do retract and extend. And when I do that, you're going to hit these lower levels to get more motion, to really move everything away, get everything moving again. And again, if doing it loaded, where your feet is on the ground, the gravity's coming down at you, doing this, if that's too much and you're noticing, whoa, that's bringing pain down my arm, we need to, again, unload it. And so you'll just unload it. Now, if you do retraction extension and you feel pain down the arm, even unloaded, it means your body's not ready. So if you're feeling better doing retractions, stick with those, because your body will feel better by sticking with those. You're not ready to progress to the next phase. So how you can do retraction extension, again, let's say it's this arm that's the problem. You can hold your head and you'll just do same thing, retract, and then let the head extend. And then you're going to use your hand to pull it up. I don't want you to use your muscles to pull it up, because we already are looking down and have a forward head. So we want to really have everything through here relaxed. So again, retract in like someone's coming in for a kiss. Retract into the hand, and then drop it straight back. And then use your muscles in the arm to kind of pull it up. Again, if you're noticing that, gosh, my arm is feeling better, my neck motion is getting better, my extension feels better, my flexion feels better, it's not as painful, you know you're moving in the right direction, and that's our goal. Because if we can do this exercise 6 to 8 times every couple of hours, we're going to start getting healing, because we're moving everything away from the damaged area in the back. So if we have a damage here because there's a herniation and we move it away, there's a blood supply to the disc that can help it heal. So if I can move the material away where it's damaged, then you're going to have healing. Much like if you have a scratch on your arm and you constantly stab it, that's what happens when we're always looking down and we're putting pressure in that back part of that disc where the nerve is. It's like you're stabbing the wound. Well, it's never going to heal. We've got to stop stabbing the wound. For us to stop stabbing the wound, it's doing retraction extension to move everything away from the damaged area to allow it to heal. And when you stop stabbing it, it will heal and you have no problems. So that's the premise behind this. That's how we can fix a a pinched nerve going down your arm by trying these exercises. And again, you can do it loaded or unloaded. You want to monitor your symptoms. Are they getting better with rotation? Are they getting better with flexion? Are they getting better with extension? Are you getting stronger through here? Are we getting stronger through here? Those are all things that you can do. Is your pain centralizing up the arm where you don't have it in the hand anymore? Now it's in the upper arm. These are all good signs that we're moving in the right direction. Again, if you're feeling like it's not helping, you're not quite there, definitely stop the exercise, get to someone who understands this. This is meant to kind of help open our eyes on how we potentially could help with healing this. You can comment below if you have any questions. If this is something that is working, put 2 thumbs up in the comment section so I know that you're trying it and it's working for you. I love reading the comments from people. And again, make sure you subscribe to our channel. We're putting content out all the time. Put the notification bell on so that when we get our next video up, you will know exactly when it's happening.